All right, a lot of developments this week in the fight against COVID-19. We want to help you separate fact from fear, okay? Let's bring in our medical expert, Dr. David Winter from Baylor Scott & White Health. Good morning and good to see you.
Good morning, Sonia. Good to be with you.
Okay, so I think let's start with the recommendation that the CDC's sort of moved around when it comes to being exposed to COVID-19 and staying quarantined. Can you kind of clear that up for us?
Yeah, new recommendations just within the last week. So if you have been exposed to the virus and quarantined for 10 days and have no symptoms, you are considered non-contagious. Actually, it's a 1% chance, but you're considered okay. Though they do recommend for the total 14 days, you try to stay away from folks, but the quarantine period is just 10. If you get a test and it's negative, then the quarantine period could be 7 days. So it used to be 14. This is quite a bit of improvement. Now, these are folks who have no symptoms. If you have symptoms, it's a different story, Sonia.
Now, when you say someone who's been exposed, let's just clear up what that means, because I think there's some confusion around that.
Well, indeed, if you've been around somebody who is sick and we think they have coronavirus, that counts. If they've been tested positive, that counts. There's not really clear guidelines, but if it's a exposure or a suspected exposure, that's what the CDC is saying. That's what the rules apply to.
Now, I've gotten some questions from viewers, and I understand, I'm sure your patients have asked you this too. Okay, I have COVID-19, what do I do? What treatments are available to me? And I think that sort of depends on who you are.
Indeed, if you're healthy and under age 65 and have minimal symptoms, those folks do well. We recommend Tylenol, other fever-reducing medications for aches or pains, drink lots of liquids, stay home, get plenty of rest, and those folks do well. If you have mild to moderate symptoms now, as of a couple weeks ago, there's some new options. There are two monoclonal antibody preparations that are available. Now, these are available in limited supply, and you have to be over age 65, have significant obesity, have some kind of chronic medical illness, or be immunocompromised. And if you have those conditions, you can get this. It's an infusion, usually done in an emergency room or hospital, and then you go back home again. These are for folks mild to moderate symptoms outside the hospital. Brand new thing. I've had 2 people that have gotten this. They seem to get well pretty quickly. So it's a great advancement, or so it seems, and the studies have suggested that in the past.
And how do you get in touch with, I mean, do you just call your doctor, call the hospital, ask for it? How do you connect with those resources?
Yeah, you have to go through your doctor, who then have to go through the process to get approval for that particular patient, and they have to have enough supplies. So these supplies are limited, and not everybody can get that right now. But if you get sick and you meet those conditions, talk to your doctor, have them contact your hospital, see if they have availability then. If not, you can try another hospital. So still, it's a new opportunity. We're just so happy to have something new in our armamentarium right now.
And I do want to ask you, Dr. Winter, I have a personal friend who is hospitalized right now with COVID and with pneumonia. I sort of feel helpless. She's been in and out of ICU, but is there anything research-wise that we're learning about those people who are severely ill?
Well, we know that they're doing a whole lot better than they did back in the spring. We have a lot of new different tools and techniques. There's actually an antiviral drug, resdemivir, that works very well for many people in the hospital. We know how to watch them very carefully and manage oxygen, typically without putting them on a ventilator. Some folks still need it, but much less than back in the spring. I'll tell you that the mortality rate for those in the hospital has gone down 42% from last spring. So good news for those folks. They do well. They tend to get depressed and lonely because they can't have but limited visitors or no visitors. So I'm pushing people to use FaceTime, call them a lot, try to get them on a computer or your own phone. Keep in touch with those folks because they need emotional support when they're in the hospital.
Yeah, no doubt. What about the vaccine? How confident are you that these rollouts are going to start and that this is going to be an effective way to keep people safe?
Boy, this is really promising. As soon as December 14th, the FDA is going to judge whether Pfizer can get theirs approved, and then 7 days later, Moderna could potentially get approved. These sound terrific. The studies have been very, very successful. They seem like they work very well. Side effects are minimal, maybe a sore arm, maybe some aches. Not many people even get that with these things. So we're excited these are going to come out. Now, they're going to be in limited supplies at first. And that's going to be the issue. Who's going to get the vaccine at first? Well, the federal government's going to have some rules about that. Then the states will have some rules and then distribute those. And so right now it looks like phase 1 is going to be nursing home patients and workers, then healthcare workers, firemen, emergency responders, policemen. Those are going to be in the first list, phase 1. Then phase 2 are those that are vulnerable, the older folks, those with chronic medical conditions, immunocompromised folks. And then phase 3 will be the general public. So I don't know if we'll get to phase 3 in the next month. I doubt it. But the encouraging news, so we've got 3 vaccines coming out soon, 3 others behind that. Then there's another 6 companies still working to develop that. We may have a bunch of vaccines by the middle to late spring. Then we can all get vaccinated. Then the challenge, can we get enough vaccinations to wipe out this virus? That's going to be the big challenge in the future.
Okay, Dr. David Winter, thank you so much for your time and insight. As always, we certainly appreciate it.
Thank you, Sonia. Stay safe, be well.
Likewise.